A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with True Chat.
Did you know that being vaccinated for COVID-19 can affect the interpretation of your mammogram? Or that doctors recommend that you wait for a period of time after vaccination? My guest today will help guide you through the process. Thank you for tuning in today. I'm your host for Mercy Moments, T. Allen Ceyler, coming to you from Champaign County here at True Chat Studios in Urbana, Ohio. For well over a decade, he has been a board-certified radiologist and is now a member of the Columbus Radiology Corporation team. Please welcome to the program, Dr. Timothy Meier. Dr. Meier, welcome. She has an extensive background in communications, marketing, and development, and is currently the marketing specialist for mammography at Bond Secure Mercy Health. Please welcome Tracy Hanlin to the program. Tracy, welcome.
Thanks for having me.
And finally, she has an extensive background in mammography, served in various leadership roles, and actually has been on the program before. Please welcome back Kathy McCarthy. So Dr. Meier, this first question is for you. What are the basic signs and symptoms of breast cancer?
Most commonly when people come to our department for their mammograms and they're having clinical symptoms of breast cancer, they usually have a palpable lump in their breast or in their armpit region that they come in to have further evaluated. Some other signs of breast cancer could include thickening of the skin in around the breast or the nipple, dimpling of the nipple or retraction of the nipple. Additional things could be nipple discharge. Typically, the more worrisome kind is when it's a bloody nipple discharge or a clear nipple discharge. And then lastly, one of the areas that you may see is some changes to the skin, whether it's some redness or some irritation or flaking.
So in addition to self-examination, what are some of the standard screening tests or exams?
Typically, the most common screening exam that most women will receive is just standard mammography. And there are two different flavors of that. You kind of have the standard mammography, which is traditional. And then there's also the 3D mammography or the tomography images, which give us a better idea of what's going in the breast, which is particularly helpful for women with dense breast tissue. Less likely screening modalities that we still use to help with the diagnosis of breast cancer would include MRI and then ultrasound for problem-solving issues. Typically, we do not use ultrasound for a screening modality.
So, Kathy, this question's for you. What are the basic differences between screenings and diagnostic exams?
So the biggest difference between the two is a screening is meant for patients that are not having any new breast problems at all. So we call that asymptomatic. They don't have any pain. They don't have any lumps. They don't see redness. They don't see an inverted nipple. So no problems whatsoever is considered screening. If you have anything other than this is just my normal yearly exam, then you likely need to be a diagnostic exam so that we can work up whatever problem that you're having.
If you suspect breast CA, what exactly is the process?
So the first thing that we're going to do, typically, depending somewhat on age, is we would start with a diagnostic mammogram. The technologist does all the imaging that we are instructed to do. We show those images to the radiologist. They let us know if any additional imaging is needed, either with a mammogram or whether we need to then move the patient to an ultrasound. And then from there, that ultrasound tech would then review the images with the physician and determine what else is needed. Typically, the next step, if we're concerned that there could be a cancer or just something that is not a cyst, would be to go to biopsy. And we can do that in multiple ways. But the only way we can know 100% for sure that it is or isn't cancer is to take tissue out, send that to the lab for them to check and see if there are cancerous cells.
So Dr. Myers, what exactly do you look for during and after an exam?
With mammograms, there's kind of three different areas or three different items that we're looking for in the breast. And mainly it's a change from the previous year or previous year's mammograms. So we're looking for areas of new calcification that are kind of clustered together. We're looking for areas of architectural distortion, which are kind of changes in the architecture or the appearance of the breast, or actually a small mass for something that's suspicious for a cancer that has a more mass-like shape to it.
So how do the lymph nodes typically appear on the images?
Usually we'll see lymph nodes in a lot of women when they come in for their mammograms. They're typical. Some of those lymph nodes live in the breast itself, which are called intramammary lymph nodes, and some of them live in the armpit area where we call them axillary lymph nodes. A lot of times we're able to say that they're benign based on that they haven't changed in several years when we have lots of mammograms to look at, and also by location. One of the characteristic things that we'll usually see with mammograms is a little bit of fat in the central aspect of it, and that's a normal finding that we'll see. So even though the lymph node may be big, if we see that fat preservation in the central aspect of the lymph node, we usually know that is not infected or involved with cancer.
So Kathy kind of touched on this earlier. What typically is the process if they think you have a problem in your lymph nodes?
Typically, we will evaluate those on the mammogram itself. That is we are able to visualize those on the mammogram. So if you have a palpable abnormality in your armpit region, that's usually how we start. The reason why we'll do a whole mammogram and not just go straight to an ultrasound targeted in the axilla or the armpit region is the major concern is there a breast cancer that could be spreading to the lymph nodes in the armpit region. Now, unfortunately, not everything that makes a lymph node big is cancer. It can also be reactive related to an infection going on in the body or some other inflammatory process. And in this case, kind of why we're having the conversation today, it's related to the vaccine. But that's just a normal process, and that's what lymph nodes do. They filter out things that are perceived as abnormal in the body, and they help fight those off.
I'd like to take this time to remind our listeners that all of True Chat's podcasts help pursue a common goal: to educate people by providing honest, open, and respectful conversations. To learn more about Mercy Moments, listen to the recap at the end of the program. And to find out where you can listen to us or engage with our program, please visit us at mercymoments.org. Welcome back. Our conversation today has been about mammography, COVID-19, and getting your annual mammograms. And my guests today have been Dr. Timothy Meier, Tracy Hanlin, and Kathy McCarthy. So in the first segment, we talked about lymph nodes. Dr. Meier, how does COVID-19, or specifically the COVID-19 vaccine, mimic breast abnormalities?
I think this is an important distinction that may be confused by a lot of people, kind of both doctors and out in the public, is it really does not affect the mammogram itself. The breast is not involved or affected at all by the COVID vaccine. Is what we're seeing when we do the mammograms is actually enlargement of the lymph nodes on the site that the patient has received their COVID vaccination. So if you had it in the left shoulder, we may see enlarged left armpit lymph nodes. And that is what's triggering some callback of patients after a screening mammogram to get a diagnostic mammogram or further workup with an ultrasound. It's not affecting the breast parenchyma itself. It's more the lymph nodes that kind of live in that armpit area.
I see.
And when we see those enlarged on the mammogram, that makes us concerned. Is there something wrong in the breast that could potentially be spreading to the armpit region? So typically we suggest that people either A, get their mammogram prior to getting their COVID vaccination shots, or B, waiting 4 to 6 weeks after their second dose of the Moderna or the Pfizer vaccine, or the single dose of the Johnson & Johnson vaccine before they come in for their mammogram. There are exceptions to that. If people are having symptoms in their breast, they're having nipple discharge or an actual palpable lump in their breast, then we still want you to come in, even if you've had the vaccine, just so we can further work that up, and we're not going to miss a cancer and delay treatment. The other reason we might want you to come in is if you're having enlarged lymph nodes in your right armpit when you got the shot on the left side.
I see.
You shouldn't have enlarged lymph nodes on the site opposite of where you got the injection. So if you got it in the left arm, you're shot in the left arm, and you're having swollen lymph nodes on the right, we still want you to come in.
So Dr. Meier, how does age play into that?
Typically, women that are on the younger side are going to have a more robust response to the vaccine than some of our older patients. That's kind of typically what we're seeing, that usually younger patients tend to have worse symptoms in general if they're going to have any at all with the second dose of the vaccine. Older patients seem to tolerate it a little bit better, but it can happen in any age, whether you're young or old, where we can see these enlarged lymph nodes on the same side as where you got the COVID vaccination.
So Kathy, in reference to the exam itself, what should the patients be telling their mammographer?
So the biggest thing we would like to know from the patient is when they receive their vaccine, their second dose, or if they still haven't had their second dose, if they're somewhere in the middle, we would want to know when that was and what arm it was received in. That way we can let the radiologist know that information. It may help them understand why they're seeing something in that area, but it won't change the idea that that area is going to need to be followed, so that we make sure that it isn't something else besides the vaccine that has caused the problem.
So why is it so important to be asymptomatic?
The asymptomatic is for our screening patients. And typically, whether you're done on our mobile unit, out in the community, or in our centers, the screening exams do not get checked by the radiologist while you're here waiting. So if you are having a problem with your breast, we need to know that when you schedule, so that we schedule that exam at a time when we have a radiologist in the office that can review your images and make recommendations for additional imaging.
So Tracy, this question's for you. Where can people go if they need additional information about mammography, COVID-19, or their yearly screenings?
They should go to their doctors. They should go to the experts, or even call the imaging center here in Springfield. I've had and I've fielded many calls from people concerned about the effect of having a immunization. But what I've read recently is that only 8 to 10%, Dr. Meier, please correct me, 8 to 10% of people, all people, men and women, have this lymph node reaction to a flu shot or a COVID shot. So it's very low to begin with. It can happen. But as Dr. Meier pointed out, it's a natural reaction in your body. What I'd like to stress today is that women need to have their mammograms every year. And I'm a perfect example of that. I'm a breast cancer survivor who had my annual screening, and it was caught extremely early, treated. And in that case, and I had the best case scenario, I'll never have breast cancer again, probably. It's a 99% survival rate.
So Kathy, this question's for you. So what resources are actually out there for annual screenings?
So Terry, currently we are following the Society of Breast Imaging's recommendations. They do tend to be on a conservative side, with having the recommendation to wait the 4 to 6 weeks after the second shot. So the Society of Breast Imaging website is where they can go and see the information about how it's relating to the imaging of the breast with the vaccine. As far as any questions with the vaccine itself, we always recommend the health department or the CDC, so that patients are getting up-to-date information that is accurate and not necessarily, just pulling it up on Google, because as we all know, everybody has their ideas on this. So it's best to get it from the experts. So the Center for Disease Control is great, and our local and county health departments are where we would recommend they're going for those questions.
So what are some of the resources that Mercy has available for patients?
If the patients are not getting the information they need from their doctor, from the Society of Breast Imaging website, the CDC, or the health department websites, they can call our imaging center at 937-390-5030. We will do our best to help answer their questions or get them in touch with who they need to get their questions answered.
Again, I'd like to thank my guests today, Dr. Timothy Meier, Tracy Hanlin, and Kathy McCarthy, for being here today. You can listen to Mercy Moments on TrueChat via Spotify, Apple Podcasts, Stitcher, or anywhere else fine podcasts are found. For Mercy Moments, Mercy Health Urbana Hospital, and TrueChat, I'm your host, T. Allen Ceyler.
I'm Dr. Meier.
I'm Tracy Hanlin.
And I'm Kathy McCarthy.
Thank you for listening today. Stay healthy, Ohio.